Nursing, David Taylor. So happy to have everyone here today, ready to get going with another great CCM. Of course, we do this every Tuesday at 12:30 Central Time. And we had to kind of pull things together really quickly here since yesterday to get this together. But I really appreciate you being here with us today, David, to talk a little bit more about COVID, because even though we've come a long way, we've still got a little ways to go. And there are tons of questions out here about what are we supposed to do now? I mean, we came through this thing, and now, okay, so we back to normal now, or are there still some precautions we need to take? Those types of questions, I think, are on people's minds. And so what we wanted to do was take a little bit of time today to try to help people understand better where we are and where, what stage in the recovery process we're in here, and when might things move back to normal entirely. And so we're not quite to that point yet, because there are still circumstances where it's wise for people to wear masks, still circumstances where we need to be careful and cautious and do social distancing and those types of things. And I don't know that we know all the answers to those questions, but we're going to do our best to try to fill in some of the gaps. And so, David, welcome. Thank you for being here today.
Thanks, Dr. Davis. I really appreciate you letting me bring this topic back to CCM today. I mean, I know we have beat COVID to death over the last year. There's so many times.
And COVID has just about beat us to death too.
It has, but overall, I think we've done exceedingly well as a department with all our agencies and everything. Everybody's just really worked tremendously, and just let me take a minute to recognize the nurses and the direct support staff that have been there on that front line every single day.
Yeah, but before you do that, so hold that thought for just a second, because that's really, really important. But I want you to introduce yourself, remind everybody who you are and a little bit about your background.
Well, I'm David Taylor. I'm the State Director of Nursing. Been a nurse for 36 years. Used to work in a hospital for about 20 of those years, and was an open heart surgery nurse. Really enjoyed that a lot. And but this is definitely DIDD was something that I knew nothing about. Honestly, I was looking for a job that was Monday through Friday with no call, no weekends, no holidays, and just applied, and fortunately got an interview, and didn't even know this program existed. It's really been a rewarding experience and fascinating. I've been amazed by the medication administration program and so many things about DIDD. But anyway, I guess I've heard a lot of different things about me. I was in the military for a few years, and loved doing that. Yeah, I guess the only other unusual thing that you can think of for me was I used to do a lot of climbing and rappelling. And for y'all that know me, I'm a pretty big guy. I weigh about 260. And it's just kind of funny thinking about somebody my size climbing, but
so that was one of your hobbies in times past, or are you still doing that?
No, of course, I don't do that any now. I've had so many arthritic knee problems. Y'all know I recently had my knees replaced. And,
that's why you had to have your knees replaced.
But I really enjoyed that, and that was I spent many years doing that, and it was quite always exciting.
What were some of the places you climbed? And
well, not any of the gigantic places. It was more locally. I grew up in Alabama, and there's just multiple different
lots of places there
to climb at. I don't know. Yeah. There's a few people that might know of a place in Tennessee. It's right over the state line. It's called Lick Skillet. Well, I guess that's probably in Alabama, but there's the Walls of Jericho there that they have a lot of huge gorge and rock formations there. We used to backpack in there and rappel and climb in there. And so it was
That
typically
sounds like a really remote place, Lick Skillet.
yeah, it's small towns,
That's
Alabama.
a perfect Alabama, Tennessee town name.
It really is. But
Well, another thing occurred to me as you were talking, David, you've actually seen a beating heart before.
a what?
A beating heart.
Yes, yes.
That's got to be an amazing experience too.
It is an amazing experience. Actually, one of the best one of the best positions you're in the OR if you're assisting the surgeon and you're holding the heart during the surgery. It's kind of an interesting thing, because when you do bypass grafts, you have to get to where the blockage is in the heart, where they're going to attach a vessel to go to bypass that blockage. Sometimes it's on the back of the heart. And so you may put your hand in the chest and have to pull the heart around to where the surgeon can get to it. And you put your hand in that position and you hold it, and then they pack the chest and your hand in ice. And you sit there 20 or 30 minutes while they're sewing that graft.
20 or 30 minutes.
And you can't move. Some surgeons sew faster than others, but we have a few that would be rather slow.
Oh my goodness.
If you're doing a lot of bypass grafts, maybe 4 or 5 grafts, and you're holding the heart that whole time for different positions, and you're getting your hand packed in ice every time, it really goes numb. But
that is amazing. That is amazing. My goodness. I was thinking, because you and I both had your knee replacements. I had my hip replaced recently, and I was shocked to look at video of people doing these hip and knee replacement surgeries. But I'm sure if I went and looked at some of the open heart surgeries, I'd be even more amazed at some of the things they do.
Yeah, well, I've done quite a few of those knee and hip replacements myself, and it is just.
So you knew what they were going to do before you went in.
Even when you see it, and it's pretty gruesome to watch, but it is really the most painful surgery I've ever had. It was quite painful.
It's understandable when you look at people doing it. Boy, I'll tell you, because I thought this was a Three Stooges thing, with the hammer and the chisels and the saws and the drills and everything. But they use every one of those things in that hip replacement.
Absolutely. We also use a jigsaw in heart surgery, because you take that saw and you cut right up through the sternum. And so those are.
Well, David, before we frighten everyone from ever having any surgery again, maybe we should enter our topic of the day here today, which is all about these COVID questions people still have. People always still have questions about these things, and I understand all the questions, because it has been confusing. No question about it. It's been confusing all the way through. The guidance has been changing all the way along, and we've just been here trying to adapt to these things. As you said, I think we've adapted very well. And you were about to enter a full-throated sort of acknowledgement of the work that the nurses in our system have done to address the COVID crisis that we've had. So I'm going to remind you and let you come back to that, since I interrupted you earlier.
Well, I just wanted to recognize, especially since we've just recently had Nurses Day and Nurses Week, and I just wanted to recognize the nurses that have worked so hard throughout this pandemic, and certainly our regional nurses, our ICF home nurses, and all the agency nurses that are right on that front line, and everyone's contributed tremendously. I know staffing was oftentimes very challenging, and it was a long, hard year, and we just want to recognize everybody for everything they did, and certainly not just recognizing the nurses. We have to also consider the direct support staff that have worked tirelessly throughout this pandemic. Also,
oh my gosh,
we just couldn't. nothing could go forward without them. And I just want to tell everybody how much I appreciate them.
It has been nothing short of amazing because I will tell you, I was just thinking, David, about last May, because it's May, and May a year ago, when we were ramping up to do the testing across the state, and where testing was a big deal then. It later became something that was more routine that we were doing,
Yeah.
but that was a huge deal when we got started doing those testing sites all across the state. And I do recall exactly what you're talking about. Our nurses really stepped up and helped us do that. And it was that, you know, what later became a little bit of old hat to us. That was an enormous effort that we had to put forth to get that done back last May and June.
And nobody got COVID from doing that either.
That, even more amazing that nobody got COVID because they were properly donning their PPE and they were taking care of themselves as we did it. And it turned out when we did that mass testing, we didn't identify that many people, but it was a good way for us to understand what was going on with our system and you know, with the people that we were supporting out there. And so I'm so happy that our nurses really stepped up for that. And then
and I'm also, you know, I'm watching those daily data statistics that we still track, and I'm just waiting for the day where we have no direct support staff that have gotten cases, and, and no people supported with cases. It's getting close, but
we've gotten very close. And I will tell you, it's in large part now that we're experiencing this, also because of the nursing staff, because of the tremendous effort that we got vaccinating people. And if you don't think the vaccinations have made a difference, you should look at our data. And I've shown it to you before, audience, but we have had a dramatic reduction within our IDD system of people getting COVID. Now, I'm just talking about, I'm not talking about just getting COVID. So if I say COVID-19, that means you got really severe symptoms. You got the syndrome, essentially, the COVID-19 syndrome. But I'm talking about even just testing positive for asymptomatic coronavirus. We've had a dramatic reduction in that over the course of a couple of months since we started getting those vaccines. We have had a dramatic reduction in the number of people who have been hospitalized because of COVID-19. We have had a dramatic reduction in the number of people who have died because of COVID-19. In fact, we've not had a single death of a person supported in our system with COVID-19 since February 1st that had the vaccine, let me say. Now, we've had a couple of deaths of people who did not have the vaccine, but we've not had any deaths among people who had been vaccinated since February the 1st. That is remarkable. And it's not direct evidence that the vaccines work, but it's pretty darn good evidence that they work. And so I encourage people, if people have held off of getting the vaccine, go ahead and get it. It's your best protection. It's better than masks. It's better than anything else that we're doing if you'll get that vaccine. Now, you maybe understand there's some people who might be limited in being able to get that, and we still need to take some precautions regarding all that. But that vaccine, you know, whether it's Pfizer, whether it's Moderna or Johnson & Johnson, they're all effective. I read recently that there were some members of the Yankees, New York Yankees, that got the coronavirus. But I believe I'm correct that those were all asymptomatic cases. Those folks had been vaccinated with the Johnson & Johnson vaccine, but they were all asymptomatic cases. So even if you get the coronavirus, it's not likely to be as bad. I do always add the caveat, David, and you know this, that it's 95% effective. If it's 85% effective, Johnson & Johnson, it's 95% effective for Pfizer or Moderna. I've forgotten what AstraZeneca's number is, but you know, the thing I want to point out is, yes, it's 95% effective, but that also means it's 5% ineffective. So you wouldn't even be surprised if you had an occasional case of somebody who had been vaccinated who ended up getting COVID-19. But even that has been relatively rare. So the point I'm making is
And
vaccines.
especially there, I mean, there's been, doesn't the statistics show that, uh, with the vaccine, there's 100% protection against mortality and severe hospitalization. And that's significant in itself, because you have to think about all the potential system problems that someone could develop from having a severe case of COVID that might be with them from now on. And there's just so many positives about being vaccinated, and I think everybody is actually seeing some of that now with all the new guidelines from the CDC and everything, and everybody kind of feels like they're being let free.
Free now, yes, absolutely.
To do whatever.
I went out to eat the other night, and I was just, oh man, you could not imagine how great that felt. Well, maybe some of you can if you've done that, but it's a great feeling to be released. And look, I totally back up. People have their own choice about getting the vaccine. And some people, like I said, there are certain conditions you might have that where it's not wise for you to get the vaccine. But other than those, it's really, a great idea to get it because it really will open you up. Of course, some people may want to take their chances. I think we're entering a phase now where everybody's had their chance if they want to get it, and we're kind of moving forward there. But I still encourage you to think a lot about it if you're not so.
Well, Dr. Davis, let's also remember that we have actually personally seen cases where someone has gotten COVID-19 again.
Yes.
In our system. So, I mean, even if you've had COVID and you think, oh, I'm good to go because I've had COVID, there's a potential for getting it again. And that risk out there is tough. I just want to encourage everybody to be vaccinated again. But, talking about some of these new restrictions, like let's talk about masks for example. Dr. Davis, are we wearing masks still?
So I think what we've seen here is that, first of all, the CDC has said among vaccinated people, so where that people have been vaccinated, that there's no need to wear a mask. But if you have been personally vaccinated, that you don't have a reason to have to wear a mask under those circumstances. There are different conditions that they placed where you do need to wear a mask. And so, for instance, when you're riding on a plane, I think, David, maybe about some of these different areas that they've said that you need to wear a mask. But other than that, if you're vaccinated, that you're good in these settings. Can you clarify that at all, or do you have any additional?
That's exactly true. I believe that's the recommendations, but the thing about that is there's still only about 40% of the population, 40% of the population had the vaccine. So that's still quite a lot of people that have not been vaccinated. So I'm kind of thinking there still might be sometimes you choose to continue wearing your mask. I mean, my wife and I went out for this weekend. We went to the mall. It's the first time we've been out to the mall in over a year. And surprisingly, there was a huge number of people that were still wearing masks at the mall. And most of the stores were still requiring a mask to enter the stores. So,
well, I absolutely think, David, and this is not so much a CDC recommendation as it is just my personal observation, but that if you're unvaccinated, you should avail yourself of every other protection. The vaccination is the best protection that you have against coronavirus. But if you have not been vaccinated, you should wear a mask. You should do everything. You should do social distancing. You should do all of the above, because you're going to put yourself at much greater risk. The group among whom coronavirus is still spreading is that group of people who are not yet vaccinated. So that is, I think just a key piece of information for our audience to have.
So, when you're talking about opening things up and things like that, what about people that want to go home for a visit with their families or go on a vacation, that type of thing? Do they need to uh, quarantine and do things like that when they return?
So I'm gonna just share what we're doing within DIDD. This does not dictate policy to others. This is only a model or a way of doing it. But we have basically said that within our community homes, we are going to let people go home on visits because we have over 90% of the people in our settings vaccinated. That's not the reason we made this decision, but it does indicate a high level of protection. And as a result of that, we are allowing people to go on home visits and we're not requiring a quarantine upon return. And we're going to continue to monitor coronavirus in these settings. So we're going to continue to conduct the testing weekly in our ICF settings. In our other waiver settings, we've said that we've recommended that they do that monthly, but in our ICF settings, we've recommended that we do it weekly. And so we're going to continue doing that testing just to monitor the occurrence of coronavirus. And then ultimately, at some point, if we continue to have good results, we're going to end up probably ending that testing. What I'm probably recommending to people on testing is that they continue testing until the Department of Health says you no longer need to do that. And that could come any day, I will say. In fact, I might have an email asking me about that in my inbox that I haven't been able to check yet. But for the time period that they're still offering that, I recommend that agencies continue to take advantage of that.
We're still testing people that have been fully vaccinated too, correct?
Say that again. I'm sorry, David.
I'm sorry, we're still testing people that have been fully vaccinated also, correct?
Yes. So, and we have run across a few, just like I was talking about the New York Yankees a little while ago. We've had a few people who've tested positive, even though they have been fully vaccinated. And it's not out of the realm of possibility that you could actually be positive. We also had encountered some what we thought might be false positives through that. But, that's an uncertain thing. You always just react to it as if it's a positive.
Well, let's see. I'm trying to think of something else that might be relevant to our audience here, and that's about what about our making home visits for clinical services or therapies and such, or in-person visits in the seating and positioning clinic and.
So our guidance here is going to change some. And I'll tell you what, do y'all mind coming on and helping me talk through this a little bit? And I'm looking over at Karen Wills and I'm looking at Michelle Bagby because they've been managing the clinicians out in the community regarding visits. And we're discussing this now as to how we're going to revise our guidance with respect to visitation. So I'm going to start us out with just this one comment, then I'm going to get Karen and Michelle maybe to comment on this. But for one thing, there's no reason to not visit at this point if the person wants to have you there. And so, say you're providing behavior analysis services, you're providing therapy services to the person, they want you to be there in person, then you can do that. I still think that it is wise to take some precautions under those circumstances. And so what I would recommend in those circumstances are a few things like checking in advance to see if anybody's been sick before you go to the house. I still would recommend in those circumstances that you wear a mask. If people are willing to share their vaccination status, maybe you can use that as a little bit of your decision making. but you know, that you begin to re-enter those situations. But the other thing I want to validate is that telehealth should continue to be something that you utilize when it's appropriate. So the circumstances that would require you to actually, you know, do a face-to-face visit would be when it's more effective than doing telehealth or a more remote type of service. I don't know, maybe I can just ask for Karen or Michelle, do y'all have any comments on visitation for clinicians?
Yeah, I'll just kind of echo some of the things you said. We are working on updating the guidance. We want to make sure it's clear that both telehealth and in-person visits are possible. Really trying to leave whether or not the in-person visits happen in the hands of the person supported or their legal conservator. As far as decision making goes, want to make sure that medically necessary services aren't being prohibited in any way visit-wise. And just make sure that we're following, you know, CDC recommendations for keeping yourself and others safe. Still recommending the screening piece just to check on, you know, not only yourself as the clinician, but also other individuals who may be present in the home. And really just encouraging people to use their clinical judgment on whether or not a service can be provided effectively in a telehealth setting versus a face-to-face setting. There are some services that do require that face-to-face visit. So we want to make sure that people are using their clinical judgment and best practices in that regard.
Karen has a comment, some commentary. Oh, she's going to come over. Okay, so she's going to come over and join me. Here, I'll tell you what, Karen, I'll let you sit.
My musical chair. So, yeah, I mean, I agree with everything that Michelle said. You know, certainly have to balance what the individual needs. And, you know, we've had a couple of situations that have come up where I think the individual may no longer feel like telehealth is effective, or at least effective all the time. And so in those cases, we would expect clinicians to work with the individual and on, you know, establishing face-to-face visits so that, you know, the outcomes goals can be accomplished with the individual, and the individual feels like they're getting the service that they are authorized to receive. As far as the seating and positioning clinics, we've just made some adaptations, and I think, you know, we'll be making some additional adaptations throughout the next week or so, just kind of refining everything. Certainly some of our environmental things that we've put in place, we will probably leave in place because they ultimately improve the overall, I guess you could say, safety of the individual when they're here. We are no longer doing screenings, temperature checks as people come to the clinic, but certainly self-checks are posted. So if you're coming to our clinic, we'll be letting you know that. And so there's a little more space and room to work. So our clinicians are still, and our shop folks, our therapeutic equipment workers are still going to be wearing masks when they're in the clinic with individuals. The individual certainly has always had the choice of doing that. And, you know, we think about the individual and their staff or family that come with them. They're really their own unit. So if they choose not to wear that mask, then, you know, they have the ability to do that. But we're taking it a little bit slower in the clinic as an outpatient healthcare facility. So yeah, so some helpful changes, but still some precautionary measures.
So one of the things we were talking about a minute ago was the word effectiveness. Michelle brought that up, Karen brought that up. And I think that's an important thing. And if there could be disagreements about whether telehealth is equally effective as in-person services in a given situation. I'm not going to try to characterize circumstances where, okay, this is great for telehealth, this is great for in-person or should be done in person. I'm not going to try to do that, but I am going to say that we did come up with one kind of litmus test for that, and that is if the person supported or their conservator thinks that face-to-face is more effective in a given situation, that's probably a pretty good indication that you need to react to it in that manner. Otherwise, where people feel very satisfied with, and you feel satisfied as the clinician with doing a telehealth service, because you should have standards yourself, right? Excuse me. I need that cough button. And then I hope I'm not getting COVID. I think I just got a little bit of pepper down in my lung. But in any case, if you're a clinician, you should have a standard, right? Because you want to make sure that the service you're offering is effective. And so when you enter a situation, you want to say, well, would face-to-face be more effective than doing it via telehealth? And ask yourself that question as well. But I did want to reinforce that idea that if the conservator or person supported thinks you should do it in person, you should probably be trying to make arrangements to do that.
Well, not to stir the pot with this, but I'm sure agencies are going to encounter a few little questions from families or individuals along about, people coming into their home. Well, how should they address that situation?
Yeah, so really this should come down to the personal choice of the people who live in that environment. So if a person supported is saying they don't want to have people visiting within their home, that is something that absolutely needs to be respected. We have determined that it's not appropriate for an agency to limit the delivery. Oh, and Karen has taken care of me by bringing me something to drink here. I'm going to do this because I don't want to keep coughing in everybody's face. Okay. But agencies, residential agencies, day agencies, do not have the authority to limit the delivery of medically necessary clinical services. So that's where the dividing line is here. They can have policies, and clinicians should follow all agency policies, but the policy they can't have is to say you can't provide your service. That there's not a method by which you can safely provide your service. That is the one thing that they can't do. And so that's where sometimes we've needed to sort that out a little bit and help agencies understand that, help clinicians understand some of the rules. But that is basically the dividing line there.
Well, Dr. Davis, what if we've got some people in a home? We got 3 or 4 people in a home, and maybe one of the people, want visitors and want people to come in, but the other 2 are not real comfortable with that yet. I mean, can we do some things like, be creative about where you visit, maybe still visit out on a patio or out on a porch, or could you kind of keep everybody away from each other while that person's visiting? Or how do you respect the rights of those other people in the home that don't want visitors while some may want visitors?
Well, life gets complicated, doesn't it? Because everybody's not always on the same page about things. I think that would be the DIDD or the IDD service system theme, right? Getting everybody on the same page, it seems to be often quite difficult. The thing about it is you have to respect everybody's point of view on things. But what you have to do, I think, in a circumstance like that is just like what you're talking about, David. You got to get creative with it and say, okay, well, if you're concerned, then let's figure out an accommodation we can make in that situation so that you could be you can feel protected and safe, and that this person can also get their medically necessary service. You were saying visit with people on the patio outside. Yeah, outside visits, as long as the weather's great. Shoot, this time of year, that's perfect. I would want to do all my services outside. But, if it's raining or, there are other limitations, then, maybe there are other things within the home that can be figured out. Because those visits don't last forever. And I probably should be calling them appointments rather than visits under this circumstance, because a visitation policy among non-professionals might be a little bit different. Although at this point, I think we're looking more broadly at visitation by, multiple groups of people, not just clinicians.
What about community outings? We're still going to move forward with community outings now, and
Well, these would fall into the area of recommendations. And by the way, you're making I think this is an important point to be made about the whole thing. I think a lot of people are worrying about other people's vaccination status. And I think as it relates to person supported, that is something I do want to take into account. But as it relates to everybody else out there, I think the primary thing people need to be concerned with is their own vaccination status. Because if they've been vaccinated, as I said in the beginning, that is the #1 best protection you have against getting coronavirus, getting COVID-19. And so if you, and by the way, at first we thought that the vaccinations did not prevent people from getting asymptomatic COVID coronavirus, right? So we thought that could still happen, and it does still happen, but there is a 72% less chance that you will even get asymptomatic coronavirus, according to one study that I read, than if you didn't get the vaccine, if you were vaccinated versus didn't get the vaccine. So you even getting a positive test is 72% less likely if you've been vaccinated. So the point being that you're really protected if you've got the vaccine. And if you don't, that's where you're going to need to be careful about going out places and being places and sitting close to people and other things of that nature, because you're going to have a much greater likelihood of getting coronavirus, getting COVID-19, and potentially dying from it. So that's if I were making a personal decision about doing an outing, that's the type of thing I would be considering. And with the 95% protection that I have from taking the vaccine, I'm doing pretty much whatever I want to do at this point. That's the way I see it.
Well, one other thing that I was thinking about for agencies is, do they still need to be doing any quarantines? I'm kind of thinking along the lines, if somebody is presenting with symptoms of COVID, they need to be tested, and certainly if they have COVID, continue to quarantine during that period of time. Is there any more that we want to add about that?
Well, I think each agency is probably going to end up having to make their own decision about whether to continue quarantining under those circumstances. There may be a multitude of factors that they're going to take into account in making a decision about what their policy is going to be with respect to quarantines. Probably you want to say that with respect to a positive test, that you should really consider whether or not that setting requires a quarantine under that circumstance. And, I'm actually not going to recommend too highly one policy or another in that regard. I'm just going to say that there are a lot of factors I think that people need to take into account as they make that decision.
Well, I'm thinking also one of the most important things that you can just remember that, it's okay to continue wearing your mask. And one of the things that I noted, even in the CDC guidance when I was reviewing all this stuff last night, was CDC reminded people that when you have when you're caring for someone and there's a potential exposure to blood or body fluids or anything like that, you still need to wear your appropriate PPE. We're following your standard precautions. It doesn't mean we don't.
This does not relieve people from wearing PPE in all situations.
Exactly.
Right,
Exactly. And so, it's okay if people still want to continue wearing those masks. That's certainly a decision that my wife and I currently still do when we're out and about. And it's so strange because it feels uncomfortable going in somewhere without a mask right now.
Oh, well,
Just because
I've
we've been
had it both ways. One, I have, been in circumstances, and look, if the place requires you or says mask required on the outside, I don't question that at all. I put my mask on, I go in, I do the rules of the place that I'm in. And so, even if I feel protected, I'm going to go ahead and add that extra layer. And by the way, if you're protecting against the other 5% if you continue wearing a mask. So there's absolutely nothing wrong with that at all, even if you've been vaccinated to wear a mask, and people should not be judged for that. I'm also not judging people for not wearing masks. I think that that's a personal decision that you're making based on the protection that you think you need. But, generally speaking, I think that you should follow the rules of whatever. When in Rome, do as the Romans do, as they once said. And so, if you're going into a grocery store that requires masks, I put one on. That's really the polite and appropriate thing to do under that circumstance, whether you've been vaccinated or whether you haven't.
Trying to see if we've got I think I saw a question come up in the chat.
All right, let's check the question out.
I think it's more of a comment. It just says many healthcare providers require hepatitis B vaccination, and I've worked for at least 2, and I frame this in the same way. So yeah, it's vaccination is just absolutely the best way to protect yourself. And
yeah, somebody else made a comment in here. I can't read it though, because I didn't bring my glasses today. So somebody else will have to read it.
I've only got the one comment on mine, so it must have been a private.
Recent study by the Cleveland Clinic. Maybe that was a personal message. Oh, yep, she did send this to me privately. Recent study by the Cleveland Clinic, January 2021 through April 2021, found that staff to have 97% effective rate just on NPR. And also by wearing, notifications came up, so I had to stop reading there. I got to turn these notifications off. They get in my way of reading the chat.
I've got it.
Oh my goodness.
They sent it to me. So it says recent study by Cleveland Clinic, January 2021 to April 2021 found their staff to have 97% effective rate just on NPR. Also by wearing masks, there was literally no flu diagnosed last year.
Yeah, that's the other amazing thing about the masks. I mean, so we're talking about masks and whether you should wear them or not. Heck, it's a good idea to wear them just for flu protection, for protection against a whole host of other things. So it's not just coronavirus, and there is this risk that, oh, well, we don't want to do anything anymore because of corona. Corona, we're kind of getting past that. And I do want to say we're not past it, folks. There are still going to be people who get it who are going to die from COVID-19. But, as we start to think that, well, all the things that we were doing to prevent that still help us prevent other things as well. They're very healthy things to do.
absolutely.
So, well, do we have any other questions down there? Well, look, I just want to tell our audience out there, to tell everybody associated with DIDD, man, this has been one heck of a year we have had this last year. I'll tell you this, in my professional life, I don't recall a year like it in my entire career. Because no matter what you do, it has been affected by this past year. And we're all trying to figure this thing out as we go. We've been over the course of the past year trying to figure this thing out as we go. We didn't do too bad a job. I'll tell you, for the most part, we did a pretty good job of coming through this crisis and doing the very best we can. I feel horrible that we lost 60 people through the Department of Intellectual Developmental Disabilities and other, ECF programs and other things, ICF programs out there. We lost 60 people over the course of this past year, and some other people have had lifelong, they're going to have lifelong effects of having had COVID-19 as well. But I do want to say that it's been a tough situation, but the service system, the people, really, the people that we have out there, the nurses, and all of you clinicians, all of you service providers, all of the person supported have been resilient, though, and getting through this thing. And I could not be prouder of the relationships that have been developed. Oh my gosh, David, just think about the relationships we've developed with the Department of Health as a result of all of this. The relationships we've developed with multiple other agencies, Department of Mental Health, other agencies, because of this COVID crisis. So,
and look at all the skills that we've developed with telehealth and so many things that we're going to continue using and continue doing.
New things and discovering that wearing these masks is something that can help you anytime, flu season, whatever. So I just want to congratulate everybody on coming through this thing and getting to the other side, almost to the other side. I always want to bring that little piece in, but we're getting there. And we're very close. We can certainly see the light at the end of the tunnel, and it's getting bigger and bigger day by day. So hang in there. We really appreciate all of you. Of course, this is the Clinical Consultation Network. We do this every Tuesday at 12:30 Central Time. And I hope to see you again here next week. What do we have planned for next week? Can you remind me?
I believe Karen is at the dietitian and the weight loss story.
We got something.
Got Spring coming back on.
Spring Garner is going to be here to talk about a big weight loss situation that she helped with. And so we're very excited to have that next week. Please join us again here on the Clinical Consultation Network. We hope to see you there at 12:30 Central Time next Tuesday. Bye-bye, everybody.
Have a good day, everybody. Thank you.